This meeting is being recorded.
So Shelby, is everybody muted still? Is everybody? Oh, perfect. Okay. So folks, I'm Dr. Roy. Many of you know me. And to my left here, or your right on the screen, is Dr. Mensah. Dr. Mensah joined Associates of Integrative Medicine, which is our supportive oncology practice. A little while ago, we worked really hard to recruit him from Maryland. He's one of the nation's most brightest and promising doctors in metabolic health as it relates to oncology. So we're excited to have him here today because he's going to help us understand sugar and cholesterol and abdominal weight a little bit better as it relates to cancer. He's with our practice. You can find us and reach us, as many of you already know, at aimnatural.com. I'll go over that again later in the talk. And you can talk to him directly through our website or by email. So I'm going to first introduce you or tell you a little bit about myself and then a little bit about Dr. Mensah. And then we're going to talk through very basic terms around what is sugar, what is fat, how does it relate to cancer care, and then we'll open it up for a Q&A. When we open it up for a Q&A, you can raise your hand by using the reaction tab at the bottom of your screen. There's a little smiley face. If you click on it, you'll see I just put a thumbs up on the corner of my screen there, and Dr. Mensah just put a hand up on his screen. You can click on that. Or you can go ahead and write in the chat. I'm going to write to the chat in the chat to everybody right now. You'll see me saying hello. As I see, Victoria's already learned how to use the chat. Thank you for sending us your email, Victoria. I'm going to go ahead, though, and be posting a better way to give me your information so we can reach out to you and get the recording to you a little bit later, Victoria. Okay? Before we move on, I'm a natural medicine doctor. I'm a fancy kind. So what that means is, for many of you who are my patients, you've already heard this before. For those of you who are not, I am both an expert in natural medicine and nutrition and in conventional medicine for cancer care. So I'm what's called an integrative oncologist. That's a board specialty. That means I'm one of the nation's experts in how to combine chemotherapy, radiation, surgery in a cancer population with natural therapies and nutrition so we can get you the best outcomes possible. Dr. Mensah is a functional medicine doctor who's also doing a subspecialty in nutrition oncology. That's just a fancy way of saying that he's focusing his part of that bridge on how nutrition, how you use fat, how you use sugar, how you sleep, and how you manage stress, how those pieces come together to impact your cancer care, both with drug treatment and radiation and in survivorship. Whether you are in cancer survivorship, whether you're beginning your treatment, whether you have a chronic disease that you're worried about progressing with, we are here for you at any point in that journey. Our job is to prevent your side effects from chemotherapy, radiation, both short and long term, to make sure that you live the best life possible, to improve outcomes and slow disease. And when you're in survivorship, our job is to make sure that we lower risk of recurrence so you don't return to this. And that's really where we're kind of going to focus our attention today. But anybody can jump in and ask us any questions about nutrition or about their cancer journey as we go through. Okay? If anybody has trouble hearing me or seeing me, or if anybody else has trouble hearing Dr. Mensah or seeing Dr. Mensah, let me know in the chat. I'll be chatting with you as we talk. So I'm going to turn it over to Dr. Mensah to get us started. Any questions before Dr. Mensah starts? Any questions about us, how we trained, any of those pieces? We work directly with your oncology team. Okay, great. Dr. Mensah.
All right, let us get started. So thank you so much, Dr. Roy, for that wonderful introduction. I almost cried. Um, Okay, so I'm going to share my screen. I'm going to be asking a lot of questions to you all this evening. So it's not to test you or put you as on, to quiz you all, but just to see what you all actually think about these topics. Because a lot of what we want to do today is destigmatize a lot of what we think about fats, a lot of what we think about sugar, a lot of what we think about cholesterol overall. Okay? Let me share my screen here. Shift to present mode. All right, so our first question, and you all can write in the chat. I can't see it right now, but Dr. Roy can see it and Shelby can see it too. Write in the chat if you all want to raise your hand. If I walked up to you or if someone else walked up to you and asked, what is sugar? What would your response be? So what is sugar? What do we think it is specifically?
You guys can unmute yourselves to answer, or you can click the reaction tab. Perfect. So Melinda's saying an energy carbohydrate. That's a good answer.
I like that. I like Melissa. I like Melinda a lot. That's wonderful. Wonderful answer.
Kim is saying carbohydrate.
This is Victoria. It's addictive.
So Victoria, we're going to mute you again. Shelby, if you could go ahead and do that. Victoria says sugar's addictive. Patricia said it's a fuel. Good. Dr.
Wonderful. I like a lot of these answers, and we will see why in a second. So, as I like to explain to patients, sugar is a fuel that gives us energy, as well as it is a carbohydrate. So what happens is when we have sugar delivered to our cells, in addition to oxygen, it gives us energy. So when we combine sugar and oxygen within our body cells, it gives us energy. Now, that does not mean when this talk is over to open up your kitchen cabinets and your pantries and start scarfing down sugar. That's not what we're saying. We're saying we get energy by the way we use sugar in the body. Hope that's making sense. So, question for our wonderful expert and all-knowing Dr. Roy, does sugar feed cancer?
So again, I want to emphasize what Dr. Mensah said. Sugar is necessary for fuel. So whether you're eating a donut or you're eating a boiled egg, it's going to be broken down to sugar because it's the only thing that the body can use for energy. So does sugar feed cancer? It feeds all of your cells. So it feeds both cancer cells and it feeds your normal cells. Does that make sense to everybody? It's so funny because we can't see you. We're always doing these talks in the dark. So I can't hear anybody telling me yes, like we used to when we did these in person. But I'm going to hope that you're putting your questions in the chat or raising your hand if you have a question.
Okay, Kim gave us a thumbs up. Wonderful, Kim. Thank you.
Well, this Victoria, I just wanted to say, I know people that's on a no sugar diet and they still got energy and they still survive and they avoid sugar at all costs.
Great. So Victoria, what that means is when you're saying someone's avoiding sugar, what you're talking about again is that they're avoiding what they're thinking of as sugar, like white sugar or a donut, right? But in order for your body to use even, let's say, an apple or a piece of broccoli, it has to break it down into something called glucose, which is sugar, in order to use it. So everything ultimately in your body is turned into a usable sugar that you combine with oxygen. So when you breathe and the air goes into your lungs and then into your cells, that oxygen and that sugar comes together to make the gasoline that runs your body. Okay, great.
Okay, so you're talking about sugar in the sense of a natural sugar that you would get out of a fruit or something like that. You know, I'm associating sugar with refined sugar, you know, like
so what I'm gonna,
white sugar, stuff like that.
Yep. So what I'm going to ask you to do, Victoria, is hold that thought until the end of this talk, because I think that we may change the way you're looking at. But I understand what you're saying, and I'm not even talking about what you eat. I'm saying instead of taking that load on sugar and thinking of it as good or bad, know that your body only can use sugar to survive. So it has to take everything you eat, whether you think of it as a good sugar, a bad sugar, or not a sugar at all, and turn it into sugar as a usable fuel. The reason we're saying this to you is we want to take away the kind of the misinformation that people have about the ideas that they around sugar. So hold that thought. It's a good thought. And Gary, I see that Gary's asking a question. Gary, go ahead and unmute yourself and tell me what your thought is, or what your question is.
Yes, first of all, I just want to make sure that you can hear me.
We can.
Yep.
Okay, so this may be a question to be addressed at a later time, but it's associated. I was wondering if sweeteners, specifically stevia, is interpreted by the body as actual sugar, and does it have the same reactions in the body as sugar? When we're trying to fight cancer, we're trying to eliminate as much sugar as possible. So we're using things like that and want to know if it has the same effects.
So Gary, that's also a great question. And I think what where we're going a little bit wrong here is I'm opening the Q&A too early, because you guys are asking the brilliant questions that we're going to answer as we go through this. So what I'm going to do is I'm going to let the talk kind of move on, and then we'll open it up for this Q&A. And that's when I'll take everybody's questions, because I bet you we're going to answer a lot of these as we go. Okay. So Dr. Mensah, I'm going to turn it over to you. Hold tight, folks. Nothing you're saying is right. It's all brilliant.
Yep, great questions. I love that we're thinking on this wonderful Thursday evening. So our next topic would be, if I ask you the same question, but except for fat. So what is fat, and what do we think fat is?
So a lot of people may think of fat as like something bad, or something that makes you look bigger, makes your clothes not feel better, or something that's associated with cancer, or something to be ashamed of, or having a big butt, or big boobs, or big thighs, or a big belly, right? What is fat actually, Dr. Mensah?
So fat, the way I like to explain it, it's a very expensive sugar. So if we think of sugar as the fuel that Dr. Roy and I myself have been explaining, it's when you walk up to the vending machine with a bunch of $1 bills. That's your sugar, because you can use it immediately when your body needs it. Fat is if you walked up to the vending machine with a $20 bill, you have enough money, you have a lot of it. But the way that we're storing it and the way that we actually have it isn't accessible to us. So we have to store it a bit differently in the body.
Okay, that makes sense to me.
Okay, another question. Where do we think we store fat? A number of the places that we store fat.
So I would think our bellies, our butts, our arms, our legs, our chins, our thighs, our armpits.
Right, absolutely. So with that in mind, is fat bad then, Doctor? Do we think fat is bad?
So I think of fat as a storage issue, right? So when we're talking about fat, instead of thinking of it again, or we're talking about sugar, instead of thinking of it again as good or bad, we want you guys to think of it as a storage issue. What that means is if we have too much energy cells, or too many dollars in the bank, too many dollars to spend, we're going to put them in a bank instead of spending it at that time. So I think when we think of fat, we can think of it as a storage issue. Is that right, Dr. Mensah?
Absolutely. That's the perfect way of explaining it.
Okay, good.
All right. So what can we do about it?
So is this where I'm jumping in, or you're jumping in?
I think this is where you can jump in, yeah.
Okay. So what we can do about fat storage or sugar? I'm a little bit lost on where we are.
Fat storage.
Okay. So I think part of talking about fat, and I think one of the misconceptions that people have is that fat is connected to cancer growth or cancer recurrence. So studies show us that it's not actually fat itself. It's abdominal weight that's correlated, not causal, but correlated with cancer incidence and cancer recurrence. Why is that? So when we evolved or were created, whatever you may believe, we evolved or were created at a time where when we were stressed and we had to protect ourselves, we either ran, we hid, or we froze. And in order to do that, we needed fast energy, energy that we could access right away. So in a world where we no longer have those immediate stressors, but we have more chronic stress, we have evolved to be able to store immediate energy very quickly. And the best place to store quick energy resources is in our bellies. So a lot of our fat storage ends up there because our bodies are still ancient and we haven't kind of evolved yet to adapt to a civilization that has a lot of stress in it. So when we're talking about fat and we're talking about sugar, we also need to start to talk about stress. Does that make sense, Dr. Mensah?
Absolutely. And just so I make sure myself and everyone else understands it. So you're saying that heavier body weight is not mutually exclusive with cancer and cancer recurrence.
That's right. You can carry more weight or be even overweight or even be obese, but if you have good metabolic markers and you're not carrying as much abdominal weight as you are carrying your weight in your behind or other places, then you are less likely to actually develop cancer or progress. So maybe we can talk a little bit about what metabolic markers are.
Okay, so metabolic markers would be things that we're looking for if you're a physician like myself or Dr. Roy run a test, and we're talking about things like inflammation that start inflaming the area, making traffic through the area very, very difficult.
So inflammatory markers are one of the things that we can use to track, not if a person is overweight or if a person, not to try and treat your weight as something as a marker that we can control, but really to track whether your weight is going to lead to a higher risk of recurrence or progression. So inflammatory markers would be things like LDH, for example, lactate dehydrogenase, or a SED rate, or an HSCRP. Another metabolic marker would be, Dr. Mensah?
Homocysteine.
Good, so homocysteine. So these are all inflammatory markers. Other things when we're talking about metabolic disease or metabolic markers is how we look at sugar. So sugar, a lot of times when people are thinking about sugar, as Victoria was saying before, we're thinking about sugar as just glucose. But really the best way to measure sugar in the body is in a couple different ways. With your hemoglobin A1C, which is a test that looks at your sugar over a 3-month period. It's a very sensitive test. Your IGF-1, which is insulin-like growth factor, and it's a test that measures your sugar over time as well, and with how much fasting insulin you have in your body. So when I think about insulin, I think about a truck. So when you put sugar in your beautiful mouth, this is supposed to be a mouth here, your pancreas reads how much sugar you actually ate, and it makes pickup trucks to pick up that sugar and deliver it to the cells. Because as Dr. Mensah said in the beginning of the talk, sugar is fuel. So we need to pick up that sugar and combine it with oxygen in order to make our gasoline. So insulin is the type of transport truck for sugar. So testing these things can help us to determine where a person's actual metabolic health is. And then when we're talking about fat, what are the metabolic markers there, Dr. Mensah?
We would look at things like your total cholesterol.
Yep, so total cholesterol and more importantly to us are your triglycerides.
LDLs.
Our low density lipoproteins.
You also have high density lipoproteins, or HDLs.
Though that I'm not going to spell things well, you guys, because we're doing multiple things at once here, but high density lipoproteins as well. So these are different kinds of fats that are also nutrients going through your bloodstream. And we're looking at these kinds of fats to tell us how the body is managing fat and whether or not it's making these fat and sugar available to cancer cell growth. These are just a few of the markers we use. They're not all of them. I don't want to overwhelm you. What I want to go back to is the point that we made is that you can carry a lot of weight and still have excellent markers, meaning low inflammatory markers, low sugar markers, and low bad fats and high good fats, regardless of your weight. So it's not weight that we want to focus on or fat as a shame-based model that we want to focus on. We want to focus on how your body uses sugar and fat. Okay. So back to Victoria's comment then. My girlfriend doesn't eat any sugar at all, and she has a lot of energy. It's how she's using sugar and fat that might be maintaining her energy. So I'll let Dr. Mensah pick it up from there.
Okay.
Go ahead and post your questions in the chat. If you want to, you can do that later or now. I just don't want anybody unmuting themselves just yet.
Yeah, and as I'm re-sharing my screen, Dr. You made another really, really good point that I want all of us to pick up on. You talked a lot about stress and fat. Could you talk to us a little bit more about what stress does to our bodies when we think about fat?
That's a really good point. So, and you guys, you've seen me talk a lot. I rarely talk with somebody else. So we're practicing sort of this discussion-based format. I hope you guys are enjoying it as much as we are. It may be a little choppy because I can't exactly remember what I was supposed to talk about. But Dr. Mensah wants me to explain to you guys how stress is related to how we use sugar and fat, which then explains why big bellies are associated with stress. Okay, so I'm going to draw over here. This is a kidney, and sitting on top of your kidney here is your adrenal gland. You have 2 kidneys in your back, and you have 2 adrenal glands sitting on top of those kidneys, one on each. When you have any sort of stress signal, so let's say I clap my hands really loud, or someone honks at you on the road, or all of a sudden a dish drops in the kitchen, you're going to have a little stress signal that's sent to your adrenal glands. When that happens, your adrenal glands release something called adrenaline. So adrenaline. Okay, makes sense? Adrenaline, the other word for that you may have heard is cortisol. Cortisol or adrenaline travel through the body to the liver and tell the liver to do one thing and one thing alone, and that is dump sugar into the bloodstream, because the liver is one of the places that we store fuel in the body. It dumps sugar in the bloodstream in order to make that sugar available as fuel to our heart, our muscles, our feet. You guys know I'm not the greatest artist here. That's supposed to be a foot. So that we can run or freeze or hide. So as you can see here, our stress signal has one job and one job alone, and that's to release sugar into the bloodstream. And that is because we evolved or were created at a time where we only had acute stressors, meaning a saber-toothed tiger running towards us or a baby falling in an icy river. But now in today's society, we have all kinds of stressors and they're chronic. The light's in my face right now. It's really hot. I'm sweating. I'm on a Zoom talk. So lots of little chronic stressors that are sending this signal to my adrenal glands. My adrenal glands are releasing adrenaline to my liver. My liver's dumping sugar into my bloodstream. But what I'm not doing is I'm not running. I'm sitting here on my butt, and so that sugar has to be stored. It can't just float around in the bloodstream. So Dr. Mensah, how is it stored?
So how it's stored in our liver is when we're building up sugar and you're having a lot of sugar. It's like you're taking in a bunch of $1 bills. So we're not spending those $1 bills. We have to quickly put all of that sugar into the bank, right? Because we don't want to lose it, because as you've been talking about, sugar is fuel. Our body finds it so, so, so precious. So we don't want to let go of any of these $1 bills in our liver. So that's where we store all of that sugar. And then this wonderful schematic that Dr. Roy just showed us, she showed us that how on your reading left, when the adrenals start to kick in, they start screaming at the liver saying, hey, we need more fuel. We need more of these $1 bills to give us that quick energy. Is that making sense to you all?
I hope it is. So one of the ways that we can store that quick fuel that we need to run, or one of the ways our brains direct our bodies to do that, is by storing in our bellies. And one of the questions that somebody just posted in the chat, which I think is an excellent question, is how come it's harder to lose that abdominal weight as we age, particularly as our hormonal health changes? And what can we do to decrease that abdominal weight through diet and exercise? So that's a two-part or three-part question. I want to say one thing before we move on to questions, which is that abdominal weight is complicated. So it does happen in different ways, whether we're male or female. It happens in different ways, whether we've had drug treatment, whether we're on drugs to block estrogen, whether we're younger like Dr. Mensah or a little bit older like myself. All of those things impact abdominal weight. But the one thing that's common for all of us, wherever we are in our life cycle, is that if we are stressed, we will put on abdominal weight. Abdominal weight is not something to be ashamed of. It's a symptom that we're not managing stress well, and that is correlated with cancer cell growth, not the weight itself. Does that make sense? Okay, good. I see my beautiful diva on the screen. She's going to be my practice patient, and she's going to give me nods and thumbs up as we go. Thank you. Okay, good. So Dr. Mensah, did you have anything else before we open it up to all these burning questions people have?
One more thing. So Dr. Roy's explained about stressors, and she used our examples like running from the saber-toothed tiger, clapping her hands. Now you might think, okay, Dr. Roy, okay, Dr. Mensah, I'm not running from the saber-toothed tiger. Does this still happen to me? Yeah, because as Dr. Roy was saying, many, many stressors happen. So that could even be an argument with a family member, anxiety with a deadline coming up at work, not even sleeping enough can give us stress. So all of these things, even if we can determine, okay, this is emotional stress versus physical stress, our body will respond the same exact way to all stressors.
That's a great point. So whether or not maybe we have a very clean diet and maybe we think we're exercising in the right ways, but we may not lose that abdominal weight if we're not looking at this foundational pieces of stress management and sleep. Does that make sense to everybody? I see Diva nodding. Thank you. Okay, so did you want to go over stress and sleep, or do you want to just open it up? Because I feel like we're losing track of where people are. I'd love to open it up. Is that okay?
Yeah, let's open it up to questions.
Okay. So let's start. So you can go ahead and post your questions in the chat or raise your hands and we'll see it. But I want to start with the questions I'm already seeing on here. So one of the questions is, why is it harder to lose abdominal weight when we have gone through menopause or are on a drug that blocks estrogen? I'm going to let you answer that, Dr. Mensah.
Perfect. That's a very, very good question, a very, very complicated one because a lot of moving pieces. So as we understand, estrogen is related to menstrual cycles, and that's probably where we kind of draw the line of what we're doing. Estrogen does many, many things in the body. Estrogen is responsible for bone health. It's responsible for cardiovascular health. It's also responsible for our metabolism and the rate at which we are metabolizing sugars and fats. So as you age, we decrease estrogen, which kind of acts as your regent director here of all your hormones. And as we're losing that director, we're losing the amount of people that are saying, okay, get back to work, sugar. Okay, fats, get back to work. Does that make sense? So even if we're before menopause, we're bathing in the maternal estrogen, as my medical school teachers would tell me. So before menopause, we're bathing in this large amount of estrogen. And then after menopause goes down, we lose these directors, as Dr. Roy beautifully just drawn for us, that's telling them, get back to work. It's time for you to be spent here. We're running a mile. We're walking up the stairs. We're exercising. Does that make sense?
Yeah, so in other words, we're losing the communication piece of how to use fat and sugar, which is why when we age, we have to use more individualized and sophisticated strategies with diet and exercise. Like, for example, a young person could just not eat or eat well for a couple of days and lose a couple of pounds. But as we get older, that becomes harder because we don't have the hormones directing those pieces. And that's true for men too, because their testosterone also lowers as they age. So for example, for someone who's going through hormonal changes, depending on their ability to move and ambulate, high intensity interval training is a type of exercise that can trick the body more efficiently or teach the body more efficiently how to use the stored sugar and fat than just going for a long 45-minute walk would. Is that right, Dr. Mensah?
Yeah, absolutely. Absolutely.
Okay, good. So what one of the questions here is, will this communication piece return after we finish estrogen blockers? So it depends on your age, right? So if you're on estrogen blockers for 5 to 10 years and you're fairly young, then it's a little bit different than if we're on an estrogen blocker at 65 to 70 and we're going to be on that for 5 to 10 years. The thing to note here, Beth, is that it's part of your life cycle to have your estrogen levels go like this over your lifetime anyways. I don't want you to get into a place where you're anxious or against your drugs. The drugs are necessary because the hormone itself causes cells to grow. That's why we have that hormone. It causes breast development so that we can feed babies. It causes uterine development so we can host a baby and grow a baby. So over a person's lifespan, we're not meant to reproduce in our later years, and estrogen will normally drop. So using a drug to block it, either prematurely or a little bit more efficiently once we're diagnosed, is a good way of lowering your risk of recurrence. So we don't want to worry about that hormone and losing the director. We want to use a more skilled strategy to teach your body to use fat and sugar. Does that make sense, Beth? So again, a skilled strategy with exercise versus instead of doing a long walk would be high intensity interval training. What is high intensity interval training, Dr. Mensah?
So high intensity interval training is if we're doing a body weight workout, a resistance band workout, even if it's aerobic workouts, we have to start by measuring our basic rate of how much we're working out. So let's say in 1 minute we do 10 push-ups. That would be our basic or beginning weight, our beginning rate. Now, if you wanted to do a high intensity level workout, what we would do is we would say, I'm going to do in 1 minute, instead of 10, I'm going to push to do 15, or I'm going to push to do 20 in that same amount of time.
So push-ups might be really hard for those of us who have had surgery or those of us who are a little bit older. But a good example would be like, I'm going to walk slowly for a minute, and then I'm going to walk really fast as I can without hurting myself for 30 seconds. And then I'm going to go back to walking slowly for a minute. So your intervals, you're introducing intervals of high intensity. That kind of exercise is a better type of exercise for losing that belly weight than, for example, walking for 45 minutes. In fact, you could do that for 20 minutes and get much more benefit than you could for 45 minutes of long walking. I want to go back though to another question here. So my cancer is a stressor. Is that contributing to my belly weight? So unfortunately, Patricia, yes. If your cancer, and by the way, some of you are chatting privately to me. If you're not comfortable putting it to everybody and clicking everyone, I'll try not to say your name, but I might make a mistake and say it. So yes, cancer is a stressor. Of course, there's a lot of anxiety associated with it, and it can contribute to belly weight as well. But I don't want you to, again, think of belly weight as being the problem. I want you to do the best you can to manage stress, and then see, and as you move forward, see what changes with your metabolic markers, not your weight. So how your blood markers look when we draw your labs. Okay, so maybe we can, I'm waiting for some more questions on here while I'm doing that. Oh, Gary had a question. Is stevia, the sweetener stevia, used the same way in the body as white sugar would? Dr. Mensah, can you answer that?
Yeah, so stevia comes from the stevia plant itself, and it is used the same way that we would, that we use sugar for, but it's different in the sense that it's not as processed as our regular white table sugar. So why we see a lot of practitioners, a lot of nutritionists recommend stevia is because we get less of those harmful side effects from the sugar when we're using it in large amounts.
So in other words, it's not using a natural sweetener doesn't mean that it's that different in your body or perceived that different in your body from any other type of sweetener. But what is different is there's less chemicals in it, and there's less compounds in it that will cause inflammation in the body. So it's less inflammatory, and inflammation also increases your risk of recurrence. I'm going to talk about that in a minute, but before I do that, I'm going to sort of list some natural sweeteners here in order of best to worst. And Dr. Mensah may slightly disagree with me on these, but I'm going to list what I think is from best to worst. If you're going to stick with sugars, you want to stick with plant-based or natural products, okay? And a little sugar is not going to cause a problem. Let's talk about inflammation. And then Mary, I'm going to come to your question there. So why is inflammation a problem? Why are we even talking about it when we're talking about sugar and fat? So if this is a blood vessel and this is your heart and these are your feet down here, the purpose of a blood vessel is it's like Woodward outside or I-75. Its only job is as a street or a thoroughfare. It's you're delivering nutrients from one part of the body to the other, just that simple, okay? So as we're eating these sugars, let's say, they're floating around in the bloodstream. They're being picked up by those insulin trucks and they're being delivered to the different cells in the body. But if we have a lot of sugar in the bloodstream, or if we have sugar that is pro-inflammatory, like a white sugar, for example, it bumps against the blood vessel wall and it irritates it. So it takes this smooth surface and turns it into a sandpaper-like surface. Fat, which you're also eating, gets stuck on these sandpaper-like surfaces like gum on the bottom of your shoe. And when it does that, Calcium comes along and makes a little candy coating. And now our 4-lane freeway, nice big Woodward, got turned into a 2-lane freeway. What happens to the pump that's pumping upstream against this flow, Dr. Mensah?
It's going to pump a lot harder than it usually would and work a lot harder.
That's absolutely right. And when it pumps harder, we call that hypertension, right? So high sugar isn't the problem. It's the inflammatory aspect of certain kinds of sugars that's a problem. In addition, this inflammation at this little plaque site where fat got stuck tells the cells to grow faster. And anytime you have cells growing faster, it's hard for your body to catch mistakes. Mistakes get pushed forward. That's cancer. So I see a lot of questions in the chat here. I'm going to go back to them. Don't worry, I won't miss you. So what's your take on using a rebounder for exercise, Dr. Mensah?
By rebounder, do you mean those portable personal trampolines?
Yeah, so I think that's what a lot of people use are those little fit trampolines like the Acon Fit, or you can get a mini rebounder from Amazon.
Yeah, absolutely. I like those because one, they give us the aerobic part of the exercise, as well as they give us some resistance in exercise as well. So I think that's a really good choice to be using a rebounder.
Great. And I think also when you're getting a rebounder, get one that has either the net on the side or the handles.
The handles, yeah.
Yeah, because I want to really avoid fractures and falls. Another good thing about a rebounder is, as Dr. Mensah was saying, estrogen and testosterone are bone supportive. And so we need other strategies when we lose those hormones to build our bone strength. Rebounders put pressure on the bone and they help to support bone strength. So good question. Melinda asked, everything is a chemical. Is refined sugar not a chemical? So that's true. I kind of forbade Dr. Mensah from being too technical here and drawing out the chemical structure of sugar. But Melinda, you're getting too scientific there. This isn't, you're not going to get a PhD in this class. So sugar is a chemical, so is my hair, so are my eyelashes, so is this computer. Every single thing in the world has a chemical conformation. So we're not talking about chemical when we say that. What I'm saying is white sugar didn't grow out of the ground, right? So sugar is from a sugarcane plant, right? That plant has to be processed, refined, and bleached to create that white sugar. The farther we are away from the whole food, the more intervention to create that sugar, the more inflammatory it is, and therefore the more it makes cells grow. Okay, does that make better sense, Melinda? I hope so. I see a question here. What's the value of overnight fasting? Dr. Mensah, do you want to ask that? Overnight water fasting, 12 to 16 hours.
That's a really good question. So that might coincide with a little bit of intermittent fasting, especially when we push to the 16-hour end of that range. Because realistically, when we eat our last meal, maybe around like 10 or 9, or maybe not even eating until 10 or 9 the next morning. So that technically would be a 12-hour fast of not eating. Now, when we push that further, what we're seeing in research is that when we're putting an extended fasting window, we're tricking the body and saying, hey, we need more sugar because we're not eating, and it tells us to get rid of excess sugar in the body. Now, one caveat I will have there is, remember what Dr. Roy was saying earlier, when you're running from a saber tooth, or when we are without food in the time when we're living in hills and caves. Not eating is a stress to us as well. So when we're talking about fasting, it's super, super important to be doing it under the guidance of a physician.
So that's really a good point. Also, intermittent fasting, Barbara, has been shown in clinical trials, human trials, to slow cancer cell growth because it stops the cell from dividing. And I'm going to go over that in a drawing. There's so many questions on here, so I don't want to miss them. Dr. Mensah, could you do me a favor and jump on the chat, or you're not able to see it?
I can see it.
Okay, perfect. Can you jump on the chat just to make sure we don't miss anything? And I'm going to sort of do a little bit of drawing here to answer that intermittent fasting question a little bit more deeply. So some of you who are, again, if you're already my patient, you may have already seen this before, but if you're not, this is new to you. There's 3 ways that we get cancer and cancer progresses. The first is poor immune surveillance. So what that means is, well, I'm going to explain what it means in just a second. The second is increased rate of cell growth. And the third is multiple mutations. So every single cell in your body, Barbara, is dividing right now. Each of these cells are making 2 daughters. Each of these daughters are making 2 more daughters, and so on and so forth. Before every single cell in your body makes its daughters, Barbara, it stopped at what's called the G0 stop point. You don't need to remember that. That's for Melinda, my scientist. But really, it's your border control station who steps in here and checks the cell at this stop point to make sure the cell has not made any mistakes. But if your border control is out smoking a cigarette, goofing off, flirting with the boys, then this cell that's made this mistake is going to pass that mistake on. That's cancer. For most of us who are struggling with cancer, we have weak or poor border control. So part of our job, Dr. Mensah's and mine, is to improve your border control with evidence-based strategies. Part of the way you can do it on your own is through intermittent fasting. And the reason why is intermittent fasting actually holds the cell at this stop point for a longer period of time, so a weak border control can step in and do a better job of catching those mistakes. Intermittent fasting does not have to be that you restrict food. It can be that you just stop eating it a little bit earlier in the evening and start eating a little bit later in the morning. It's not the right choice, though, for everybody. So for each patient, we come up with an individualized strategy looking at your metabolic hormone, your metabolic markers and your hormones and your cancer journey. And we come up with a strategy that will help you in particular to lose that belly fat and bring your metabolic markers under control. So I hope that helped, Barbara. Judy, I have read that muscle burns more calories than fat, so exercising to build more muscle helps you to lose weight. Is that true, Dr. Mensah?
Yeah, absolutely. So building muscle tissue, one, it has to be it's more active in the body than fat tissue is, because one, fat is storage, right? So fat is not it's not just, oh, it's the reason why I can't fit into my favorite dress or my favorite pants. We're destigmatizing what we're thinking about fat. Fat is storage, and as storage, it's not going to be active because it's waiting. Now, muscle is active because we use our muscles for everything that we do. So if I'm talking with my hands, if I scratch my head thinking of what to say to you all, if I'm blinking, if I'm smiling, if I'm walking, all of those muscles need sugar, need fuel to operate. And that's why it's more caloric depleting than fat would be.
Dr. Mensah is trying to avoid using big words. I see your hand raising. I see your hand raising, Sue. Hold on one quick second. I want to say to people, I love what Dr. Mensah just said, because again, we're trying to take away the idea that fat is stigmatizing, or that fat is a bad thing. It is a storage issue. So the question then that people always have, Sue, I'm not ignoring you. The question that people always have is does fat and sugar also feed cancer then? The answer to that is yes, but restricting fat and sugar wholesale will not fight cancer. There's a lot of books, there's a lot of articles, there's a lot of misinformation on the internet that if you starve yourself in a very specific way, you will be able to cure cancer or fight cancer effectively. That's not true. You have to have an individualized strategy for how you do that, because your body uses fat and sugar differently than my body does or Dr. Mensah's body does. So how you use fat and sugar is more important than restricting it wholesale. Sue walked away, so I couldn't get her question. I'll come back to her when she comes back to the camera. The next question there is, I've read that older people need more protein at each meal to be even more effective in building muscle. Is that true?
Well, that depends on the person because one, health is not a one size fits all. So I can't say the protein that I'm going to need in 10 years is the same amount of protein that Dr. Roy will need in 10 years, is the same amount of protein that Diva that I see on camera or Miss Lara that I see on camera would need in 10 years. And that will all change. Now, do you need your adequate amounts of protein each meal? Absolutely, yes.
So good. So the type of protein I want to say also matters because an older person is going to not digest certain kinds of protein as well as a younger person might.
Absolutely.
So for example, we might use more of a gentler plant-based protein with an older person than we would with a younger person who's trying to build their fitness. We might use a more whey-based protein, for example. So I'm seeing some people are asking questions about their specific cancer. And I want to say to you, I'm putting this form up here. You're going to click a link on the chat. I want you to click on the link and put those specific questions that you have about your specific disease or your specific journey on that link, and we will reach out to you personally because I don't want to out anybody, number one, and number two, it's a little too big of a group for me to talk about people's individual journeys, okay? Or for Dr. Mensah too. I'm taking a full body circuit or bodywork abs class. Do I need to recover a day in between? If so, would classes such as Zumba, yoga, or Pilates count as recovery?
Yeah, absolutely. I think all of those classes would be a great option for active recovery. Now, depending on who you are, your previous physical activity history, your time of recovery is going to be very, very different, right? And especially as we age, we'll need different recovery periods. So do I think taking a recovery day in between workouts? Absolutely. I think that's a great choice.
Studies show actually that we need 300 minutes of vigorous exercise a week to lower the risk of recurrence with breast, colorectal, lung, and prostate. But I think that that's so aggressive. That would mean that people have to be exercising 50 minutes a day vigorously. I think these studies are skewed because they're not looking at how your serum markers show up. They're just looking at things like weight generally and recurrence. So I think what the problem is with a lot of this data in the natural medicine world and with a lot of drug treatment is it's not individualized. It's a one-size-fits-all approach that doesn't work for everybody. And that's where we need to get sophisticated. So for example, if you are an older woman who is going through who's just been diagnosed with breast cancer and you're going to be getting chemotherapy and radiation, we are going to want you to eat high nutrient, high caloric foods and kind of eat whatever you want because one, we want to maintain your weight because that helps radiation be more effective. And two, we want to maintain your weight and maintain your calories because that helps chemotherapy be more effective. We're not going to ask you to eat on the days following chemotherapy because if you don't eat on those days, that's just fine. You need to stay hydrated. We're going to work on your taste because it's really important to maintain weight. Once that person finishes treatment, however, and they're now in survivorship, let's say, at that point, we're going to look at, okay, what did these drugs do to how your body uses fat and sugar? So for example, when you get chemotherapy, you also get steroids. Steroids change the way your body uses fat and sugar by causing dyslipidemia, high bad fats and low good fats. Our job then is to treat to that problem and fix that in that individual using a tailored strategy, not of restriction, but of supplements that will help to manage those fats while reintroducing them to eating normally and talking about plant-based diets. So that's where our focus would be then. I'm just realizing I left the window open and someone decided to mow their lawn. So I'm going to speak a little loudly, but I might get up to close that window. If that person who's in survivorship did not have good outcomes because for whatever reason, they didn't see us, they started out with stage 4 disease, whatever it might be. And half our population is stage 4. Everybody does well. I don't want you to feel defeated if the cancer is other places in your body. If that person, however, does have a stage 4 disease, depending on how they're able to function, we might put them on a very restrictive plant-based diet with intermittent fasting. And we may do all of our work in the beginning on improving their gut health, because that's where most of our immune system lives. And we want to make sure they're absorbing nutrients appropriately. So it is not true that you can just starve your cancer by starving yourself of sugar. That's a very kind of, not ignorant, but it's a nonsense thing to say, really, because when we're talking about this, you see, it's really very individual and it's very specific. I'm going to ask Dr. Mensah to see if we can answer Gary's question, and then I'm going to go close this window while he does that.
Oh, right. So
Gary had a question. If we are juicing as part of your healing plan, can you continue with juicing while intermittent fasting?
That's a great question. So it will depend, but simply put, I will say yes. And here's the caveat here. Yes, in the terms that in how Dr. Roy was explaining cancer and depleting the amount of resources we can give to cancer, the fasting as well as juicing will help us starve the cancer. However, I will want to say it's depending on your individual nutrient status, because other things that we talked about is making sure that we maintain a good weight. So for already intermittent fasting and juicing, our caloric intake is going to be a little bit decreased. So we don't want to be losing weight because that's going to be pointing to lesser and poorer outcomes in our cancer care, which would make things like our chemo and radiation a bit more difficult to tolerate. So I would say that if we want to juice and we want to intermittent fast at the same time, making sure it's under the direct supervision of a physician.
Like one of us. And also, I would say about that juicing, that restricting over long periods of time actually will raise your weight because your body is, again, very ancient. Hi, Sue, I'm going to answer your question in a minute. So so your body is still ancient. So if you restrict, your brain is going to tell your fat stores and your other sugar stores in your body, store more fuel because, oh my gosh, a famine is coming on. And so it will store that fuel and it'll store it aggressively and be very hard, very difficult, very reluctant to let go of it because your brain is afraid of those fasting periods. So intermittent fasting has to be done in an educated way to soothe the brain while allowing the body to go into that senescence period where we can screen for cell errors more efficiently. Sue, I'm going to unmute you. What was your question? Can you unmute yourself? It's the bottom left, that little microphone. And while she's figuring that out, what is considered vigorous exercise?
Here, it's off.
Okay, perfect. Wait for one moment and let's just answer this question first, Sue, and then we'll get to you. What is considered vigorous exercise?
Well, that isn't my question, is that? I didn't give a question yet. I didn't say anything.
I know you didn't. I was gonna hold your question, but I'll answer you
okay.
first, Sue, since you're on. What was your question, my friend?
Well, I'm in a panic, frankly. I've had a lot of different cancers. I've never been on a diet. I don't believe in them. I'm eating right, but it's always, I have to now get another colonoscopy. They found something now in my colon for a change. And Dr. Oz once said, it's like genetic. Like I don't have weight anywhere. I always wanted a tummy tuck. I never did it because nothing would be in the right place. That's the only reason I never did it. So I worried because he kept talking about the momentum, that the fat inside, it's not the fat outside, it's the fat inside. And I've gone up to a lot. I've been in a health club forever, but they always say it's genetic. You can't lose weight in one place, but that's a very scary place to have white, because your BMI can be low and you still look like you're 4th month pregnant, even if you're not. So to me,
Right.
I'm very nervous.
So those are all really good points, Sue. I'm going to mute you again and we're going to address some of those, okay? So one of the things that Sue said is that she has struggled with a lot of different kinds of cancers, even though she feels like she does everything right, so to speak. And that's true. In her case, she's carrying a genetic risk for cell errors, meaning when I was talking about before how the cells in the body are making their daughters, and before they make their daughters, they're stopped by border control, which looks at the cell and checks for mistakes. Her border control is not doing a good job. It's lazy, it's out goofing off, and so cell errors are allowed to be passed on, which is why her strategies may not be as successful. But she herself, as you can see, is a vibrant, happy, successful person who is living a beautiful life. So it's not necessarily a tragedy here. It's just, how do we get Sue to stop passing these errors on? And in her case, diet and exercise may not be as effective as supplements and drugs, which are used in a targeted way to lower the risk of these errors being passed on. The other thing she mentioned is there's different kinds of fat in the belly. There's the omentum. The omentum is like the mama fat. I don't mean that it's like mommy belly or all that crap. I mean that it's like a mothership that lives in the stomach, and it feeds your organs so they can function normally. So your liver, your small intestine, your pancreas, it all needs that omentum. Visceral fat is kind of when we have that little pooch, people call it, under our belly buttons. That's more on the surface, and it's a different kind of fat. And sometimes when we have ovarian disease or colorectal disease, they talk about removing that omentum. And one of the things Sue is concerned about is she losing an organ that's really important for nourishing her body? And the answer is yes. And it's really important to come see us, because we can help you to navigate that so that we still have good outcomes regardless. Okay. So I want to come back to these questions here. What is considered vigorous exercise, Dr. Mensah?
Vigorous exercise would be considered any type of physical activity that is going to deplete the amount of not only sugar that we have, our fuel, but then also our oxygen. So if we're running super, super fast, if we're using the rebounder for a very extended long period of time, swimming for a long period of time. This will also depend on who you are specifically, because one person's definition of vigorous exercise and what exhausts them out in terms of their fuel will be different from the next person and what's going to exhaust and deplete their fuel.
Okay, so what he said at the end is very important. So a good definition for vigorous exercise is anything that causes you to be a little bit breathless, but you can still talk on your phone. So if you can talk on your phone, but you're breathing heavily, like, oh my God, you guys, I was blah, 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 but you can still walk, that is vigorous enough for you. Okay, I want you to be very cautious about falls, guys. I don't want you running a marathon right now. Okay. We're running close to time. So Shelby, we're going to just answer some more of these questions and maybe give it another 10 to 15 minutes if people want to stay on, and see if we can help close this out, because I want to make sure everybody gets what they need. And again, I keep saying in the chat, I'm posting this link. This link, if you click on it, will send you directly to our email, and it allows us to let you know when we're speaking next. It's always free to you, but that way you get some awareness about those opportunities. We do not contact you for any other reason. If you do have questions, as I see some of you do, about your personal cancer journey, then you can put it in that little link there. Whoops, I don't know what just happened there. I don't want to be viewing Deborah's screen. There we go. You can put it in that link there, and we will reach out to you and answer that question if you want us to. So the next question here is, does drinking green tea interfere with intermittent fasting in the morning, for example? It does not, Susan. Green tea is just fine for you. The only things I would say about green tea is at more than 3 cups a day, it will interfere with a lot of our cancer drugs and a lot of our chemotherapy drugs. So we want to be cautious with green tea. Green tea is a wonderful anti-cancer natural therapy, but it has to be used carefully. And then another question I see here is 3 meals a day or several smaller meals, which is better? So this is a good question, Mary, because we were going to talk about this and we kind of got a little bit away from us. Dr. Mensah, what about eating frequently and eating throughout the day? Why is that important, or is that important?
It is important in the sense that, in keeping our theme consistent throughout a wonderful discussion here, when we're eating more frequent meals and smaller meals throughout the day, we're telling our body to not trigger the stress and start up stress that tells us to release so much sugar into the body. Okay, so when we're eating more frequent meals, we're able to get our heavy nutrient, our caloric dense foods that are healthy for us for our outcomes, versus stressing out the body and then telling the body to just release sugar to circulate and swim through the body that might not be within our health goals.
Perfect. So I want to say it one more time, a little bit slowly so you guys hear it. Intermittent fasting. So, okay, let's say we're eating breakfast at 9 and we're stopping food at 6, let's just say. And then during the period from 9 to 6, we're eating frequent small meals that have high quality proteins in them, low or high quality sugars in them, high quality fats in them, high quality carbohydrates in them, and they're frequent throughout the day, tells our ancient brains, don't store sugar and fat because it's not necessary. But if we have a high level of stress, then our brain will tell our body to store it anyways because it's preparing to run. Okay, I hope that we got those 2 pieces really clear to you guys. Does that make sense? I'm seeing Sue wrinkling her face. I'm looking for Diva because she's taking a lot of notes. Did that make sense, Diva? Okay, perfect. I love having a friend to look at as I go through these, because we're just looking at blank space here. We're in the dark. I'm a 5-year breast cancer survivor, and I would like to get on an individualized plan to reduce abdominal fat. 1, you need to reach out to us. That is one of the things we do, especially Dr. Mensah. But 2, you don't need to reduce abdominal fat per se. You need to lower your risk of recurrence, and at the same time, lower your risk of heart disease and diabetes, right? And the way to do that is an individualized nutrition, exercise, supplement, and stress management strategy that will help you as a symptom to lower your belly weight. Okay? Okay, good. Is fresh juicing or tea acceptable than just water during intermittent fasting? It absolutely is. Momentum was removed as part of my endometrial cancer surgery. Would interventions be advised to help keep the body healthy? Absolutely. So our job, let's go back to, let's use an ovarian cancer patient. So I'm going to go from beginning to end. My lovely Jane, I'm just going to call her Jane. Jane is diagnosed with ovarian cancer. Should she come see us? Yes, because Jane is going to get a debulking surgery that will remove the omentum, and she will also get carboplatin and Taxol as a chemotherapy treatment. Our job is to make sure we support her immune system, give her a pre and post-surgical plan so that the surgery doesn't impact her immune system, give her a plan to prevent side effects from carboplatin and Taxol so that she sails through it feeling well and that she's healthier after treatment than before. Is this possible? 110%. Our patients have better metabolic markers after chemotherapy radiation for cancer treatment than they did when they did not have cancer, because that's how skilled we are. When she's done with treatment, my job is to, or our job, excuse me, is to protect her heart and her kidneys long-term, because carboplatin is toxic to the heart and kidneys long-term. And in doing so, we're also going to help her lower her risk of ovarian disease, because we're going to get those metabolic markers tight with Dr. Mensah doing a plan for diet, exercise, stress, and sleep, and me doing a plan with drugs and supplements to lower risk of recurrence. That's what an ideal individualized cancer journey looks like. So it should ideally, we should ideally be partnered with your oncologist, which we are. 70% of our patients come from your oncologists. How much sleep is healthy? So Sandra, how much sleep is healthy? Dr. Mensah.
I usually like to tell patients to get between 7 and 8 hours of sleep. Now, I also want to put a little bit more details in the sleep, not just how long we're sleeping, but the quality of our sleep. So that's going to depend on things on if we have issues falling asleep, if we have issues staying asleep, and then also how we feel when we wake up in the morning. So we can get 8 hours of sleep and then completely not have any energy to get throughout the day. That would still be concerning to me versus the patient that comes to me and says, oh, I only got 5 hours of sleep and I feel great. I'm alert, I'm aware, I'm able to get through the day without a nap. That I can give them a smooth sail on to continue with the 5 hours. But then with the patient who says, I slept for 8 hours, I'm gonna say, okay, what time did you go to sleep? When was the last time you ate before you went to sleep? How many times did you wake up while you were trying to sleep?
Yeah, so Dr. Mensah, can you pop up that sleep slide really quickly? Dr. Mensah is going to share his screen because we were going to try and talk a little bit about supplements and sleep hygiene. So this is a good place to just put that in, and maybe we'll close it out here. I see someone's asking for a recording. If you go to aimnatural.com, Diva, and you scroll to the bottom of the screen, so I'm just going to show you what that looks like really quickly right now. I'm just going to share my whole screen with you. That might have been a mistake because you're going to see my email here, but that's okay. I'm going to go to the website, aimnatural.com. If you scroll to the bottom here, see how it says this got this little video icon. If I click on that video icon, it's going to take you to all of our talks, and there's hundreds on here. And Gilda's will also post it in their library, so you'll be able to access it through Gilda's website as well. Okay. And we do a lot of these, Diva. So make sure you give us your email address so I can make sure you get an alert for them. Okay. Going back to sleep, the sleep slide, Dr. Mensah, do you still have sharing capacity?
Right, yes, I do. Sharing my screen right now. So a few things that I like to do for energy and stress and sleep. So one, we have Fight to Zone by Thorn. I like this one and all the other show you guys because I think it has a very, 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 very good safety profile for you all. Now with Phytozone, this is one that we would call stimulating because it helps us with our energy throughout the day. So these are the type of supplements that you'd want to take in the morning or in the afternoon, but we don't want to take these at night because then we're going to stay awake because we're going to have a little bit too much energy. The next one.
Well, okay.
Hmm?
I was gonna say, let's just, we don't sell these supplements, so it's not gonna make sense to patients to post them too much, but what he's trying to say here, and I didn't realize what slides you had. Can you exit for them from that? What I think Dr. Mensah is trying to say here is there are combinations of herbs that can be used to help you to sleep better. But this last question here about from Kim G, are there any things we can do to improve our sleep quality? That's kind of where I wanted to pick up. And sorry, Dr. Mensah, I didn't mean to interrupt you. I just didn't realize we didn't have this slide. There's a lot of things we can do, Kim, and then Dr. Mensah, you can kind of close out with talking about some of the herbs in Phytozone or cortisol manager. We can make sure we're sleeping in a dark room, Kim. That's really, really important. And it has to be pitch black. The reason why is, again, we've been talking a lot about how our bodies are really ancient. So when we evolved or were created or whatever you believe, when the sun went down, the lights went out and our brains produced a certain amount of melatonin. That hormone is a hormone that's upregulating our border control. So remember how I talked about your border control is looking for cell errors and catching them before they get passed on as cancer. So why did we develop a hormone in response to a lack of light? Because darkness is critical to fighting cancer while we sleep. So it's very, very important that you mimic an ancient type of atmosphere where you have no light exposure at night. So that means cell phones, televisions, street lights, ambient lights. You can use a blindfold. Another thing is to make sure your room is really cool. So a room that's cooler is going to tell your brain it's okay to burn those fat stores a little more efficiently, and you'll burn deeper sources of fat. So you'll see belly fat start to go down if your room is cooler at night. I don't love air conditioning, but a fan in a window is okay in the summer, and try to keep your room as cool as possible. It's really important to have some sort of ambient noise, and the best way to do that is an air filter, because think about it, most of our time where we're really getting that deep inhalation and exhalation is when we're sleeping at night. So I want that air to be really clean. If you don't want to pay for an air filter, that's just fine. You can get some plants. So if you Google a TED Talk, how to grow fresh air, or you buy things like peace lilies and keep them in your bedroom, they will clean the air while you're sleeping. You want to make sure you're using non-toxic bedding. So I use only plant-based bedding, so latex mattress, etc. So non-toxic bedding, so that you're not deep breathing in bleach, detergent, chemicals, and other types of fibers while you're sleeping. You want to make sure that Dr. Mensah mentioned it, you want to have a little bit of protein before bed. So if you are intermittent fasting, you don't want there to be a 6-hour gap between your last meal and your bedtime. There really should only be a 2-hour gap. So if your last meal is at 6, you really need to be starting to get ready for bed at 8, because you want a little bit of protein before bed. I don't think everybody should be intermittent fasting. So if you're not intermittent fasting, any kind of protein snack. What would be some examples, Dr. Mensah?
High protein, good nut butters, like if it's an almond butter, pistachio butter.
Yep, I love
Avocados for some healthy fats as well.
I love that. So I don't love meat, but if you have to have it, turkey, cheese, and crackers is a good snack before bed. Dr. just mentioned avocado. You could do a little bit of a shake with almond milk, avocado, and a little protein powder, like Orgain protein powder is a good one. They have a vegan formula. A little bit of oatmeal with almond butter in it. Why do we need that protein snack before bed? And I'm just talking about 1 to 2 ounces because it stabilizes that blood sugar when we're sleeping. So remember, we talked about that little stress signal that tells your adrenal glands to release adrenaline, which tells your liver to release sugar. If we eat a little bit of protein before bed, it lowers that stress signal just a little bit so that that sugar is a little more even throughout the day and we have less cravings and we don't wake up between 3 and 4 so easily, okay, to go pee or because we're sort of all of a sudden alert. Another thing that's really important for sleep hygiene is a sleep routine. So turning down your lights and turning off electronics, having a bath, a sleepy time tea. We have excellent sleep teas that we personally design for our patients right before bed. I think a news fast is really important. I don't want you watching really traumatic things right before you go to bed because you're already traumatized, right? 40% of cancer patients have PTSD, 80% have anxiety, 60% have depression. You don't need any more trauma right before bed. You really want to be cautious about what you put in your mind. So guided visualizations are excellent. And one that we really love is from healthjourneys.com. There's a couple on there that are excellent. One specifically for sleep, but the one I like best for cancer patients is healing trauma. What am I missing here, Dr. Mensah? Anything? Oh, supplements. You just said them. So supplements. So we use a lot of different supplements to help you to sleep better. Things that have theanine in them, for example, things that have hops in them, for example. What other things, Dr. Mensah?
Ashwagandha, lavender.
Lavender, perfect. GABA. So there's a lot of different ways we can go about this, and we want to be cautious that we're not interacting with drugs or things that you're already taking. So these are things, Kim, that you can do. Kim, you mentioned that you have sleep apnea. So for you, it's really important to sleep a little bit elevated and on your side, or to get fitted for a CPAP so we can make sure you're getting oxygen to your brain, but elevated on your side until you get that CPAP in place. And that helps us go, that idea of sleep apnea helps us to circle all the way back to the beginning. Sleep apnea can be aggravated by that big belly, but instead of thinking of it as belly and bellies being bad, we want to think of it as how can we lower our stress? How can we exercise the right way for us? How can we use nutrition to manage the way we use fat and sugar instead of thinking of fat and sugar as cancer causing, because they are not. Nobody got cancer from eating too many bananas or eating too many Kit Kat bars. Nobody in the history of mankind, I promise you, okay? I see a couple more questions here. I'm sorry we can't get to all of them. It's already 7:30 and I want to let you guys get to bed. Dr. Mensah, any closing thoughts?
Nope, not at all.
Oh, good. I know that you guys probably have burning questions that we didn't get to. I want to remind you again to go to, can you put that first slide up, Dr. Mensah? To go to our website. You can click on the contact us page. You can scroll to the bottom and click on the videos and watch a lot of talks. And you can also let us know that you want us to reach out to you, and we will. We do reach out to you just to answer questions. You don't necessarily have to be our patient, so don't be afraid, okay? You're very welcome, people. I really hope that this was as organized as we wanted it to be. Again, it was such a pleasure and an honor to talk to everybody, and we're going to hand it over to Shelby.
Thank you, Dr. Roy and Dr. Mensah, for volunteering your time to help educate us tonight. Again, I could just listen to you guys all day. I feel like I always learn something, and I always feel like I come out of like a therapy session just listening to your voices. So thank you for your time and for helping us learn. And we will be sure to get these videos up for you guys to review and get down any information that you might not have been able to take notes on throughout.
Okay, perfect. And Dr. Mensah just posted that information in the chat one more time. If you guys just want to take a picture of it or just copy down that phone number, you can always call and ask us any questions you have. I want to say before we go, it is our honor and our privilege to treat you. Every patient we treat is like a prayer because it humbles us and we get to be present with you in the hardest times of your life. We do an excellent job, but we would be nothing if it weren't for your transparency and your vulnerability and your trust. So we love you. Rest well. Go get in a cold room, get your protein snack, get to bed. Good night, everybody.
Have a great night.
Okay, bye-bye.